Depression is observed more frequently among young people and adults compared to the elderly and children. Moreover, with the symptoms we recognize today in children compared to the past, children are also struggling with depression. In fact, signs of depression can be seen as early as 4 or 5 months old due to hereditary conditions or other factors, and some infants show early signs of depression. A small percentage of children face this issue during their childhood. We also know that there is not much difference in the percentage of depression between urban and rural communities globally. The percentage of depression and anxiety disorders is quite similar in developed, developing, and underdeveloped countries. Furthermore, global studies across different cultures indicate that while some cultures may display certain depression-related symptoms more than others, in some underdeveloped societies, the lack of emotional vocabulary leads to the use of words related to other concepts. For example, some African communities use the same word for both sadness and anger. If these matters are carefully considered, we reach the conclusion that depression is a human issue regardless of age, living environment, or level of social development. The only notable difference is that women are more likely to suffer from depression compared to men. Unfortunately, depression is prevalent everywhere and acts mysteriously and secretly. Since almost everyone experiences depression or its symptoms after difficult life events, it might be more accurate to call it the psychological cold. Just like a cold, it is common and doesn't significantly affect everyday life. But when it reaches severe stages, it can become dangerous and destructive. When a person suffers from this illness, symptoms appear that, if recognized early, can help in seeking treatment. Although mild depression is sometimes considered a psychological cold and can seem to resolve on its own, it can leave lasting damage that becomes problematic in the future. That's why it is essential to pay close attention to these symptoms. Since the symptoms may vary across different age groups, it is important to emphasize certain stages of life. For this reason, depression symptoms in children, young people, adults, and the elderly are slightly different. Let's first address the general symptoms of depression in adults, typically between the ages of 20 to 60 or 70. These symptoms should persist for about 2 weeks without relenting, and more than half of the symptoms mentioned must be present for a diagnosis of depression to be considered likely. Some of these symptoms may indicate mild or chronic depression, but not what we refer to as clinical or major depression. This is similar to the gradual heating of water, where warming is one issue, but boiling is a separate one. It is important to distinguish depression as a condition independent from other mental or physical illnesses, as it can sometimes be a sign of a more severe mental disorder like schizophrenia, or even physical conditions such as gastrointestinal diseases. Depression itself can also have negative effects on many bodily functions, especially the digestive system. When we talk about depression, it is considered separate from the possibility of other physical or psychological illnesses. Some medications, and especially narcotics, can also cause depression or reveal its symptoms, but I will not go into that here. Thus, the discussion is about depression as an independent illness. As I mentioned, the symptoms need to persist for at least 2 weeks, affecting the person's relationships, life circumstances, and overall situation in a way that is noticeable to themselves and others. Here, I will mention the 30 primary symptoms of depression, and if at least 15 are present, the individual is likely experiencing depression. If 7 to 14 symptoms are present, the person may have mild, chronic depression known as dysthymia, which lasts for about 2 years without disappearing for more than 2 months at a time. Unfortunately, chronic depression is common in many societies due to familial, educational, social, and political factors. Symptoms. The first symptom of depression is a decrease or even a complete lack of energy and the ability to perform tasks. Depression can reduce a person's energy to such an extent that even simple tasks like getting out of bed, going to the bathroom, or even eating can become difficult and distressing. The person not only reduces their normal activities, but may also struggle to meet their basic needs. The second symptom is a reduction in appetite and the desire to eat, or even to enjoy food. In some cases, hunger pains are ignored, and the person makes no real effort to eat. Decreased appetite, along with other physical challenges, usually results in weight loss. A person may lose about 5% of their weight per month, even without drastically cutting back on food, and can lose 10 to 15 kilograms over 2 to 4 months. While some individuals may experience an increase in appetite and weight gain during depression, this accounts for less than 10% of cases. In children, depression can hinder normal weight gain and, in some cases, lead to weight loss. Depressed children may struggle with eating, often influenced by internal factors or parental behavior, which can exacerbate the issue. Regardless, decreased appetite and weight loss are significant physical signs of depression.